watching Virginia This Morning. This segment is sponsored by Bon Secours Virginia Breast Center.
A mammogram is an important step in taking care of yourself and your breasts. And whether you're a newbie to the procedure or a veteran, knowing what to expect can make all the difference. Dr. Polly Stevens with Bon Secours Virginia Breast Center joins us this morning. Dr. Stevens, it's nice to have you. Thank you.
Thanks for having me. Thanks.
We talk often about mammograms, but there's still, if I had to define what it is, I probably couldn't share that. So what's the easiest way to define what a mammogram is and what it does?
Okay, a mammogram is basically just an x-ray of the breast, and when you go for your yearly mammogram, they'll take 2 pictures of each breast.
Well, that's simple enough.
Yeah.
Are there different kinds? Should I be asking for a certain thing when I go in to have my mammogram?
Oh, that's a good question, because more recently we've started with a 3D mammogram. So the basic 2D mammogram is the traditional mammogram, and in the past 2 to 3 years we've introduced a 3D mammogram, which is very similar. When you get the film, it's you won't notice any difference, but it actually takes a series. Instead of just one picture of the breast, it'll take a series of 12 to 15 pictures in each view, and it's most useful for younger women with very dense breast tissue.
So that would be a conversation with your doctor. Am I the right candidate for either one of these, and or they're going to suggest from the get-go, let's start with this?
Correct, yeah. So in general, older women should be fine with a regular old-fashioned 2D mammogram, and younger women would benefit most from a 3D mammogram.
A lot of folks here, smushed like a pancake, I'm just going to put it out there, they're uncomfortable, you kind of get through it. How do you prep for these? I mean, people get really, we get really worked up about it.
So I guess it seems like the fear factor is overblown. I mean, most women, when you ask them how bad was the mammogram, they'll say, fine, it wasn't bad. But if it is something that you really dread and is painful for you, you can pre-medicate with a Tylenol or ibuprofen. I always tell people they could have a Bloody Mary, but probably not.
maybe after, right? Take after.
They do have pads, actually. Really, if it's a very uncomfortable experience, just talk to the technician who's doing the mammogram. Sometimes they can add an extra padding on the mammogram machine, and just they can make an effort to be a little more gentle.
And are there things that you do to prepare for a mammogram? Are there any steps to take that you need to be aware of? I feel like I've heard you don't wear deodorant, or are there things that you need to do?
Oh, that's, yeah, good question. So deodorant, the reason you're not supposed to wear deodorant is because sometimes deodorant has little flecks of aluminum in it, which will show up on the mammogram, and then it looks like a defect on the mammogram. So correct, no deodorant, and most facilities actually have a little stash of deodorant that you can put on after your mammogram before you leave.
Just to save your coworkers and friends.
Right.
That's right. Your doctor, I'm sure, will work with you on all those steps to take before you're getting ready to have that mammogram. You've suggested, Tylenol or a Bloody Mary, if that's what it calls for. But all kidding aside, what happens when the mammogram is over? How long do results take, and what should you expect?
Some places will give you your results immediately, and if you are concerned, you can request that. Most of the time, you get a letter in the mail within a week or so. And occasionally, patients are called back to have more pictures done. And I will try to put this out there. If you get called back after your mammogram because they need to take a closer look at certain areas, then don't panic, because very frequently, those extra views turn out to be fine. So mammogram is a screening exam. They're looking for very small changes, and it's important to evaluate any little change that they see on the mammogram, and 80% of the time, those changes turn out to be normal changes in the breast and not cancer related. But definitely go back and get those extra pictures done.
And most importantly, have it done. And we're out of time, but I do have a really quick question. A lot of folks watching today may say, well, Virginia Breast Center at Bon Secours, I'm working with XYZ doctor. They still can make this decision to come in and work with the partners here.
Yeah, so you can have your mammogram anywhere in the city and then go see doctors anywhere else. We're very open to sharing, sharing all our information.
Excellent. You got a great team. Thank you so much for being with us.
All right. Thanks for having me.
Appreciate it. The Bon Secours Virginia Breast Center has 3 convenient locations: Westchester Medical Park in Midlothian, 601 Watkins Center Parkway, Suite 200, St. Mary's Hospital in Richmond, 5875 Bremo Road, Suite G11 in the South Medical Building, and Memorial Regional Medical Center in Mechanicsville, 8220 Meadowbridge Road, Suite 309. For all the information and to schedule your appointment, call 594-3130 or visit the center's website. It's vabreastcenter.com.